It's a great honor for me today to rise and introduce to you and through you to members of this Assembly a number of seniors and friends and family with us today from the Canadian Association of Retired Persons, Elder Advocates of Alberta, Public Interest Alberta, Seniors Helping Seniors, Seniors Action Liaison Team, Seniors United Now, and Friends of Medicare. Every one of these Albertans deeply concerned by the health issues directly impacting seniors, including prescription drug costs, the availability of quality long-term care, emergency care, and more. Mr. Speaker, I would ask them to rise in the House now and be welcomed by the Legislature. Medications are essential and a daily cost for seniors. Money spent on medications to keep seniors healthy, like controlling blood pressure and diabetes, can be considered money saved, both through preventing complications and hospital. They are protecting health and saving health dollars. My questions are to the Premier. Will the Premier admit that the new pharmaceutical plan is a further tax added to seniors?
The Honourable the Premier.
Mr. Speaker, our government cares deeply about seniors. We know that Mr. Speaker, we also know that our seniors are looking at their investments that have diminished dramatically over the last number of months, and we're working together with all ministers to ensure that we maintain one of the best programs for seniors in the country of Canada, from long-term care to various housing options to home care, and we'll continue to provide those resources to our seniors.
Honourable Leader.
Well, thank you, Mr. Speaker. Why is the government using total income and not net income for determining seniors' annual income and as a basis for their expenses for health care?
The Honourable the Premier.
Mr. Speaker, the Minister of Health has all of the details on the program. All I want to mention to the House and to the seniors that are present here today and many that are watching is that those who cannot afford to pay for badly needed drugs will have a program in place that they can apply for assistance to make sure that no Albertan, senior or younger person, can get the drugs that they need for improving their health.
My final question to the Premier. Will the Premier admit that this is his own policy and not that of the Minister of Health to charge seniors more for their pharmaceuticals?
The Premier.
This is a government policy. It had, it had considerable input into formation of the policy, all towards maintaining the badly needed services tied to health. We know a senior population that will be increasing dramatically over the next number of years. I mean, I'm part of the baby boomer generation. We're getting there. I know I look a lot younger, but so this is what we're working towards, to make sure that it's sustainable, that we provide the best services, and to ensure that the next generation can also have the same kind of quality of life that we're enjoying in Alberta today.
Right. Second official opposition main question, the Honourable Leader of the official opposition.
Thank you, Mr. Speaker. My next questions are for the Minister of Health. We have a Minister of Health who believes that, quote, there should not be a sense of entitlement when you turn 65, end quote,
shame.
and who dismisses the legitimate concerns of Albertans as whining. This attitude in a cabinet minister is extremely disappointing. To the minister, does the minister admit that by using income from 2008, we seriously underestimate the income seniors will be facing in 2009?
The Honourable Minister of Health and Wellness.
Mr. Speaker, as the Premier has mentioned, that and I stated in the House earlier to a question that the economic situation in the world has changed since we brought this policy through. The policy, Mr. Speaker, is still the right policy, but we've had a number of seniors raise issues such as the one the honourable leader has raised relative to some of the mechanics, if I could, right, relative to what line of income. We're taking a look at all of those situations, and we'll make a determination as we go forward.
The honourable leader.
Thank you, Mr. Speaker. What is the minister's explanation for removing premium-free Blue Cross coverage for seniors, a plan that's been in place for over a decade?
The honourable minister.
First of all, Mr. Speaker, the honourable member is not correct. Currently today, every senior pays 30% of their prescription costs up to a maximum of $25, no matter how poor or how wealthy seniors are. Mr. Speaker, I think this is a perfect time for this question because on the news this morning, Mr. Speaker, we had a situation where General Motors and Chrysler are back at the table for more money. We have Air Canada on the verge of going into bankruptcy, Mr. Speaker. All of these companies fundamentally have problems with their business model. Now, if we take that into healthcare, Mr. Speaker, we have to change the fundamental business model of healthcare, certainly in this province and I believe in this country, because, Mr. Speaker, I'll finish the story in my answer to the next question.
The honourable leader.
Well, it's indeed revealing that the Minister of Health sees healthcare as a business. That says a lot about what we're headed for in the next decade in healthcare, Mr. Speaker. How does the minister justify the largest jump in Blue Cross premiums occurs when a person turns 65?
The honourable.
Mr. Speaker, I'll complete my story. This has nothing to do about business. This is about comparing where we are in healthcare. So let's take a fundamental business model in healthcare today, Mr. Speaker, because I tell you, if General Motors and Chrysler go broke, we can still buy a Toyota car, Mr. Speaker. And if Air Canada goes into bankruptcy, we can fly WestJet. But if publicly funded health care, which this government stands on, goes broke, as some of these members would like to see it go, we will have exactly what they don't want to have, American-style health care. So we want to change the fundamentals to preserve the publicly funded health care in this province.
Seniors and often their families are concerned about their ability to find a long-term care bed when they need it. And the government's continuing care strategy has done little to reassure our Alberta seniors. My questions would be to the Premier. Mr. Premier, I too look a little younger than I am. Does the Premier feel that the first bed policy for long-term care placement that allows seniors to be moved from family, friends and community is a fair way to treat our frail Albertans?
The honourable, the Premier.
Mr. Speaker, first of all, I do agree with the member that she is very young looking. Never get caught in that debate, I can tell you that. The honourable member raises a very good situation. It's a good question, because without a doubt, long-term care rates in Alberta compared to other jurisdictions are very low, okay, or lower, let's put it that way. But, however, I do know, representing a rural constituency, where sometimes for a period of time when a person, suffers some catastrophic event, perhaps a stroke, or they fall in their home, something happens where husband and wife now are separated for a period of time where they're put in a long-term care situation, perhaps, may not be in the very same community for a period of time, a few miles away, and it is difficult for the senior that's at home, the spouse, possibly doesn't have a driver's license. How do you visit? You depend on family, or you depend on that home care nurse. I know that situation. We understand that situation very, very well, and that's why we're increasing the number of long-term care beds, but also let's give seniors choice in terms of assisted living, additional home care, all of those different models, rather than, for whatever reason, always institutionalizing our seniors. That's not a quality of life.